Hello, Dr. Emma Craythorne here with another episode of the After Hours Skin Clinic, where we give you the lowdown on the latest skincare. And the latest skincare is really important whenever we're talking about teenagers, which is what we're going to talk about today. So this episode is all about teen skin. And I'm here with my colleague from clinic and dear friend, Dr. Ellie Rashid.
I'm so excited to talk about teen skin.
Me too.
Topic close to my heart.
Me too, because it's a topic close to my heart in clinic, but also at home, having two teen daughters. When we talk about teen skin, we're really talking about once the change has started to occur in the skin. So moving from being your typical childlike baby skin to usually becoming a bit oilier or in some cases a bit more sensitive, but a change has started to occur in the skin. And for some people, that can be actually as young as 8 or 9. You might see that. That's pretty rare. On an average, it sits at around about 11 or 12. And those changes go right on through, usually starting to even out at around about 17 or 18. But that's just a typical curve. It can be either side of that.
I just love teenagers. I just love them. I love seeing them in clinic. I love their energy. I just love teenage skin. And I love the difference that you can make to someone's confidence.
I love that as well. In fact, I just had a patient, a teenager, on the Bad Skin Clinic this weekend. And, this was somebody who, she had PCOS. So it's polycystic ovarian syndrome, where there's excess hair growth on the face, and also had acne and lots of dandruff. And this young girl had just about to do her A-levels. She's actually finished her A-levels now. And she really just didn't have any friends. She wasn't going out. She wasn't seeing people. She wore a mask every day to cover her face. And she wore a mask to school every day. And just putting very simple, and it is simple, things in place. Yeah, you're right. It's like the story of, the beautiful swan at the end of the story of the ugly duckling. It's just
transformative.
It really
My
is.
one is always when teenagers come in and they've got their sort of long hair covering their face, or like the really excessively long fringe, head down, posture, all completely like hunched over. And then when you treat their skin and they grow in confidence and they come in like hair out their face, just their whole posture is completely different. And yeah, I think that's why I love teenagers.
Yeah, I know. And they always have such interesting stories to tell you. I actually learn so much as well, because there's actually been a few TikTok trends that I had never heard of, and then come to, this. And I was like, these TikTok trends. But actually, there was evidence behind it. It's like, thanks. I've actually learned something new. So thank you, teenagers.
Well, I get them to help me with my IT deficiencies when I don't know how to access something, don't know how to make something work.
Like TikTok.
I'm going to get a teenager to help me.
To Gen X. So what are the differences then? Let's think about the basics of teen skin. It's so hard to be generalistic, isn't it? Because all teenagers don't have the same skin. And, when we give out advice to teenagers as a whole, the same advice doesn't suit one teenager as suits another.
Yeah. And the changes that happen to a teenager's skin is largely as they enter puberty, the hormonal fluctuations and their increase in androgens usually means that their skin oil glands get bigger, produce more oil, more sebum onto the surface of the skin, and that changes the ecosystem that lives on their skin, their microbiome. And it's usually as a result of that increased oil and sebum and the change in the size of their glands that drives conditions that we see commonly in teenagers, like acne.
And to that point, on the other side of that, there's another group of teenagers that actually don't get acne, and they actually have sometimes an increase in sensitivity of their skin. And that increase in sensitivity can sometimes cause spots to appear across the mid-face. And that's actually a condition called rosacea. And often the treatment that would go alongside for acne can actually make rosacea worse. And I don't know if you've noticed in clinic, because, lots of teenagers are really putting more creams and lotions and potions on their face than ever before. Over the 20 years of doing dermatology, I would say now teenagers are really putting much more on their face than they did. But do you ever notice these tiny little papules that appear on the lateral aspects of the cheek? So this is the lower part of the cheek, just to the back above the jawline.
Yeah.
These tiny, tiny little monomorphic, and they never occur in people who have acne. It's almost, if you see these, this person does not have acne. It's related to a sensitivity of the skin. So I think on the whole, most teenagers will have acne, but there's this small group that don't get acne, will never get acne, but are then actually slightly more prone to the skin sensitivity. And actually any acne treatments would make it just a whole lot worse.
And the other thing I see increasingly in teenagers are these little cysts that they get around their eyes, like the little milia. And I think just where you can use quite rich formulations on the skin, and there's so much interest in like the little shadows around the eyes. And so even as a teenager, you're putting all these rich, thick creams, occlusive ingredients on, and sometimes you increase your risk of getting milia on your eyelids, around your eyes, and all of that skin there. I mean, I've now developed milia, and I'm 41 because I just use so much skincare.
You should know better, Dr. Ellie Rashid.
I know. It's so tempting. And I'm not getting much sleep, as you know.
Little babies.
I know.
But that's the kind of sleep that is worth not getting.
Yeah, exactly.
Teenagers are really bombarded, aren't they? Because you've got this element of peer pressure, which always has happened with teenagers. You either have this desire that you really want to fit into a certain group, or you actually really don't want to fit into a certain group. But those ones almost forming your sense of identity with use of skincare products. So before you'd say, oh, I've got my Levi's and my certain trainers, to fit into that group. But now it is, I've got my lotions and potions that I bought because that's what this influencer has shown. And this is now what my bedroom shelf has on it, or my bathroom shelf has on it. And this is what my vanity has with all the different products. And I said to one of my teenagers, well, why have you bought this? This is not going to be suitable for your skin. And, it was bought not because of what this pot of chemicals might do, but just because it was the pot, just about having that essentially as an ornament. And yes, they may well use it from time to time, but it wasn't being bought in the way that we think of buying.
It was for the packaging.
For the packaging.
So interesting.
For the packaging.
My biggest thing that teenagers come to me and want is this sort of flawless skin. And when I say flawless, even the appearance of their pores bothers them. And we need to make sure that people understand that having pores is a normal part of your skin structure. And even though there might be treatments that people on social media might say gives you this poreless, blurred look, it just can't be achieved. I think what we can do is soften the debris that can sit within our skin pores and cleanse our skin effectively, but you can't shrink your pores or dilate your pores, but you can improve the appearance of them, but you can't have a poreless face.
Yeah, I look after a lot of patients who do have poreless faces. And the reason why they have poreless faces is because I do a lot of work with scarring and laser for people who have been burnt. And essentially, if you have burnt your face, and I mean burnt it in a fire, and you have to have full thickness skin grafts put on your face to reconstruct your face, or after, see some people with acid attacks, then you don't have any pores because your skin does not work in that way. And actually not having pores is pretty horrible because your skin can't cool down in the same way, your skin's not moisturised in the same way, it can't move or stretch in quite the same way. So you should be pleased to have your pores. These things are so important.
Yeah, essential structures. And I think the pressure on teenagers to have a certain look and to achieve a certain skin type is incredible at the moment.
And what do you think drives that?
I think the increase in using filters on social media, how common being on social media is, looking at people applying their makeup, but the application of their makeup is put onto a filtered video. And so you think that makeup is giving you this sort of wonderful, perfected look, but actually it's all been created by filters.
I agree entirely. So because of being a dermatologist, I get asked to go to a lot of events, just like you do, Ellie. And I meet a lot of beauty influencers. I meet a lot of content creators. And a lot of their get ready with me videos or, videos that they're doing, putting the makeup on, just as you say, is done using filters. And they're very, very clever filters. Or even if they're not using a filter, the lighting is set at 90 degrees. So it's like literally hitting off the face. the camera is put up to its brightness on that particular point. And so even if a filter is not being used, the environment is being created essentially to act as a filter on the face. And when you meet these people then in real life, away from the kind of photo image of that person, their skin is very, very different.
Yeah.
I see it on myself whenever I am doing the television series, The Bad Skin Clinic. I don't really wear much makeup on the show at all. And the camera is a camera. It doesn't have any filter on it whatsoever. But the lighting in the room and the way the lighting sits, my skin looks great, you know. And I was like, that's my skin. There is no filter on it. There's no makeup on it. But the way the lighting just done to create it, it's like, that's not the same skin looking back at me in the mirror whenever I'm waking up. And I mean, I've got an adult brain and I can understand that difference. But even myself, if I was constantly bombarded with my own image, whether it's from a website or whether it's from my own social media or whether it's from the TV show, if I then look in a mirror, I mean, there is a disconnect. So you can see why people do kind of think, oh, well, that's an achievable thing. And, you know, this image I'm looking back at me in my own mirror face now is different.
Yeah, most people will create their videos in a specific spot in their house that's got the best amount of natural light. I mean, I do it. If I'm doing videos, I go where there's a big patio door and the light floods in, and I would look completely different because I don't have that same lighting in a different part of my house.
Yeah.
And that's why I don't film there.
It's exactly the same. So I think that's where this pressure comes from. And then teenage skins are going through a change. They've also gone from having, oh gosh, you know, that gorgeous, like 8-year-old skin that's so spongy and so cute.
Gorgeous, bouncy.
Yeah, no UV damage, no damage from all of the products that we put on it. Just great skin.
Yeah.
And it just does go through changes. And it's not that it's not great skin anymore, but it's just different. It's just had a change.
Yeah, it just needs modifying your skincare routine to suit your needs at that time.
If you're enjoying these episodes and like what we stand for here at the After Hours Skin Clinic, then please do me a favour and click subscribe. We're just starting out and it really helps us grow and reach more people. My team and I would really appreciate your support. Anyway, enough of that and on with the episode. And what about these trends and things like that on TikTok? Do you get people coming in asking you about these new products or trends and whether they should be doing them? And have you learnt anything from any of the trends?
Yeah, I have actually. I genuinely do learn stuff. So one of the trends that is really big is the little black things that you can see on the sides of your nose. People mistake those for being comedones or blackheads, but what they actually are your sebaceous filaments coming off your oil gland. And so what people do use to try and improve the appearance is they use these pore strips. Now, as dermatologists, we usually say not to use things like pore strips because it can traumatize your skin and sometimes make your skin worse as a result. I wax my facial hair, my little moustache, and this is way before TikTok or social media. I used to then also wax the sides of my nose to get rid of those little sebaceous filaments.
It's kind of like the same thing.
And then, years later, pore strips come out.
You could have made a fortune.
I know. I was doing it before it was even a thing. And I love looking at the little wax strip with all these little sebaceous filaments on there. So as someone that uses pore strips, wax strips, after I've waxed my moustache, which I don't let anyone watch me do.
Why do you not just get lasered?
Do you know, I'm a dermatologist and I've never had any laser hair reduction.
Oh, we need to fix that.
Immediately. So yeah, I learn what products are available, even what ingredients people are really into. And then you also learn some of the maybe not so great trends. So sort of very young people using lots of different acids and exfoliating ingredients on their skin all at the same time and causing a reactive skin condition like perioral dermatitis.
One of the things that I see that teenagers come in with, well, obviously we've talked about acne, but is a social media trend as well of using these pimple spots.
Yeah.
So this is like our zit sticks, and they're essentially small little stickers that you can put on top of a spot that's already formed. And they're made of hydrocolloid. They're usually around about the size of maybe a centimetre in circular diameter, and they're transparent almost, so you can put them on a spot to cover it. But you can also get them in fancy shapes like stars or hearts.
Yeah.
And they've become really quite a trend. I actually really, really like these. And it was TikTok that introduced me. Well, not TikTok because I'm not on TikTok, but my children through TikTok introduced me to these. And I think they're a brilliant idea. I don't love the ones that have got additional chemicals in them. So some of them have tea tree oil or salicylic acid or alpha hydroxy acid. And I don't love the ones that have anything on them because I think that could potentially be a little bit irritant or annoying for the skin, let's say. But the plain hydrocolloid ones, which is just the name of the ingredient for the dressing, to cover it really provides this lovely healing environment as well as stopping the temptation to pick at it. And it covers the spot as well.
So lots of dermatologists online say absolutely no to these spot stickers. I love them too. Yeah. But that's because I'm a real picker. And so just by having something on there, a physical barrier means that I then won't pick at the spot. And with my skin type, I get awful post-inflammatory pigmentation.
Yeah, so I do see that some people don't like these, but I love them. So for the pickers and to provide that nice healing environment, great. I mean, they're not going to be good for anybody who's got kind of comedones, so blackheads, white. I don't do anything for those. But an isolated, big, red, juicy spot that you're otherwise tempted to pick, or it gets that pustule head on it that really doesn't look great and you can't cover with makeup. Well, I think they're a winner.
Yeah. Do you know what I think should be banned? Magnifying mirrors.
Yeah, me too. They should just be gone.
Gone. We just don't need them. Who needs a mirror that magnifies their skin to that degree?
Well, I think they're actually designed for men and women who are probably over the age of about 45, 50, who are starting to not have their near sight anymore. And so therefore, if you're kind of 60, 65, 70, okay, anything above that, it would be difficult to be able to put your mascara on, your eye makeup. So then that way you can see yourself without having to put your glasses on. Maybe we should just put like an age restriction on it. So you're not allowed to look in this unless you're over the age of 50, shall we say?
I mean, I definitely don't have one, but whenever I go to a hotel, there it is. I'm in there. Like a blackhead that no one else would see, but I would be like, right, I need to get all of them.
Or they just have to come with like a warning on them.
Yeah. Don't look at yourself with this mirror.
But teens do that a lot. They will have these magnifying.
They do, with the light on. And yeah, it really magnifies normal skin and normal structures within their skin, like their pores, which they then try to reduce the appearance of, but maybe not in the correct way. So by putting too many things on all at once, too many exfoliating ingredients, and then they just strip their skin and damage it and cause inflammatory reactive problems.
I mean, we could go into a whole other episode, I think, just about acne on teenage skin or any of these particular issues. But shall we wrap up this episode by thinking about what would be the generic skin routines that you would recommend for a teen? I mean, I'm going to recommend the two for Florence and Saffron, my two teenagers. And I think it's probably fairly generic. They don't have acne, but it would still be something that could be transferred across, I think. Cleansing is very important.
Very important.
Particularly in teenage time. Acne's got nothing to do with you having dirty skin, but it's really important to cleanse the skin, particularly if you're wearing makeup and your SPF. So number one is a cleanser. What's your recommendation?
Yeah, my recommendation is CeraVe cleansers. I like them. You can get the salicylic acid cleanser, the blemish control cleanser, hydrating cleanser, or Cetaphil. I like Cetaphil cleanser as well. Non-comedogenic, which means it doesn't clog up your pores. And then my second tip is usually a moisturiser. Usually something that's got hyaluronic acid in it, like a good hydrating ingredient.
And I say a moisturiser for all patients who are teenagers, pretty much.
Yeah, I do pretty much.
Yeah, because even if you've got oily skin, quite often if your oily skin falling into acne, you might well be on an acne treatment, which you're putting on at nighttime, so a topical targeted therapy or taking tablets by mouth. So therefore, you don't want to then be drying out your skin even more so by avoiding moisturiser or using a really harsh cleanser. So you still need to use that moisturiser, particularly if you have acne and you're on acne therapies.
Yeah, it just needs to be a moisturiser that's not cloggy, i.e. non-comedogenic or oil-free. You're winning.
Effeclar H, La Roche-Posay, I would go for.
I do like Effeclar H, yeah. I do. And then SPF, whatever age you are.
And if you've got oily skin, there's a lot of these SPFs, if you look at them specifically that say oily skin, they'll have mattifiers in them, which is really nice because they're these little slightly silicone balls and they absorb the excess oil. And so then if you're somebody who's got particularly glowy skin from having too much oil, it mattifies things. So it might be useful to look out for something like that as well.
And do you recommend vitamin A, so retinoid, at night?
So the number one treatment that we as dermatologists know for treating acne or comedones, so these are blackheads, the number one treatment is to use a prescription retinoid, either adapalene, Differin is one that would normally be recommended, or a tretinoin.
Yeah, and it would all be done under the supervision of a dermatologist. So I don't think you, as a young teenager, should be going out and buying retinol. It's a really specific group of teenagers, and tretinoin would be prescribed and it would be supervised under the care of a dermatologist or any other healthcare provider that deals with skin.
I think that's a really important point because people will often go and then try and get retinol or retinol.
Exactly.
And actually that is not proven to treat acne. So yeah, stick with the stuff that the doctor says.
Yeah.
What we don't want to do is start introducing unnecessary chemicals to beautiful young skin that doesn't need to be there. But unfortunately, there's a lot of marketing and there's a lot of attention paid to this group of people whose parents are quite happily buying them lots of skincare that they really don't need. So typically it's just understanding how to wash the skin properly, and if you want to do anything is trying to protect the skin from too much UV damage, so putting on an SPF whenever it's appropriate. Right, well that's enough for today. I've really loved talking all things teen skin, and there's definitely a lot more episodes that can be brought out of these topics that we've faced today. So thank you so much for joining me, Ellie.
Oh, it's been my absolute pleasure. Love talking about teenage skin.
If you enjoy listening to us and the After Hours Clinic, you've probably already subscribed. But if you haven't, go on, subscribe and make our day. It's totally free and it helps us reach other people. And it also means that you're not going to miss another episode. See you next time on the After Hours Skin Clinic.